What if one of the most powerful foods for your heart, immune system, hormones, and long-term health has been sitting in your kitchen this whole time? Most of us treat garlic as a flavoring. We chop it, throw it into a hot pan, and never think twice. But when garlic is crushed or chewed, a chemical reaction produces allicin, a sulfur compound linked to cardiovascular, antimicrobial, anti-inflammatory, and antioxidant effects. If you started eating a small amount of raw garlic every day, here are 5 possible benefits and how to prepare it safely. First, it may support healthier arteries and lower blood pressure. Allicin can help relax blood vessel walls, improve circulation, and reduce processes involved in plaque formation. Some studies show modest reductions in systolic and diastolic blood pressure, especially in people with elevated readings. Garlic isn't a replacement for prescribed medication, but for men over 50 with slowly rising blood pressure, 1 small clove a day may be a simple supportive habit. Important detail: allicin is heat sensitive. Crushing garlic and letting it rest about 10 minutes before cooking preserves more allicin than throwing it straight into a hot pan. Second, it may support healthy testosterone and hormonal balance. Certain sulfur compounds, like diallyl disulfide, have been studied for effects on luteinizing hormone, which signals the testes to produce testosterone. Most evidence is from animal and lab studies, so garlic isn't a proven treatment for low testosterone. It may also help by reducing oxidative stress and inflammation, which can indirectly support hormonal function. Persistent hormonal symptoms should be evaluated medically. Third, it may strengthen immune defenses. Allicin and other garlic compounds show antimicrobial, antifungal, and antiviral activity in lab studies and may help immune cells like macrophages and natural killer cells. Regular garlic consumption has been linked to fewer or shorter common illnesses in some studies. This is a supportive measure, not a cure, and works best alongside sleep, nutrition, exercise, stress management, vaccination when appropriate, and medical care when needed. Fourth, it may improve cholesterol and support liver function. Garlic has been associated with small reductions in total and LDL cholesterol and may influence liver enzymes involved in cholesterol production. Garlic also contains sulfur compounds and antioxidants that may support the liver's metabolic and protective systems. It's not a substitute for prescribed cholesterol medications, weight management, or dietary changes, but used consistently it may contribute positively over time. Fifth, it may protect cells from oxidative damage. Garlic's antioxidants and sulfur compounds can help neutralize free radicals and support the body's antioxidant defenses, which may protect blood vessels, brain cells, and other tissues from oxidative stress. Diets rich in garlic and vegetables are associated with better cardiovascular outcomes, though garlic alone isn't a magic bullet. So how should you prepare raw garlic to maximize allicin and make it tolerable? Crush or finely chop the clove. Crushing brings allicin and the enzyme alliinase together to form allicin. After crushing, let it rest at room temperature for about 10 minutes to allow allicin to form. If you plan to cook, crush and rest first, then add to the pan to preserve more beneficial compounds. To reduce strong taste and odor, mince 1 small clove and mix it into a tablespoon of olive oil, a spoonful of honey, or some yogurt. You can add crushed garlic to salad dressings, hummus, or sauces. Some people swallow small pieces with water like a supplement, but do not try to swallow a large uncut piece. When is the best time to eat it? There's limited evidence that an empty stomach is superior, and raw garlic can cause burning, reflux, or nausea in sensitive people. Eat it at the time you tolerate best. Many prefer with food or before bed to sleep through peak odor. How much should you eat? For most people, 1 small clove per day is reasonable. Start with half a clove if you're new to raw garlic and allow several days to adjust. More isn't always better. Larger amounts increase the risk of digestive upset and strong body or breath odor. Important precautions. Garlic can affect blood clotting. If you take anticoagulants or antiplatelet drugs like warfarin, aspirin, or clopidogrel, consult your doctor before consuming large amounts. Raw garlic can irritate the digestive tract. People with reflux, gastritis, ulcers, IBS, or sensitive stomachs should start small and eat it with food. Because of bleeding risk, patients are often advised to stop concentrated garlic supplements before surgery. Follow your surgeon's instructions. Some recommend stopping about 2 weeks prior. Garlic can also interact with certain medications and may affect how the body processes some drugs. Pregnant or breastfeeding women, people with bleeding disorders, and those on regular prescription medications should seek professional advice before using medicinal quantities. The simple routine: crush 1 small clove, let it rest 10 minutes, combine it with food if needed, and consume once a day. Start small, monitor how you feel, and talk to your healthcare provider if you take medications or have medical conditions. Remember, garlic can be a useful daily habit, but it's one part of a healthy lifestyle that includes a balanced diet, exercise, sleep, and medical care when necessary.